You are aware of this marijuana solution.
How beneficial is medical cannabis for cancer patients undergoing chemotherapy and radiation therapy treatment?
Okay, so we can look at that from a couple different directions. Okay, I think that the most evidence, and granted, this is all, most of this is anecdotal because of our inability to study this properly, like every other treatment that we have in our country. But the immediate benefit of being able to reduce the nausea so that a person doesn't get dehydrated, can keep their fluids down, can keep their food down, can actually eat something and can feel and not feel nauseous during this treatment. That's an obvious, very right off the bat. Now, there's lots of other areas that we could be talking about this with cancer. For instance, bone pain and other types of phantom pain, even that some people have had, even after limbs may have been removed. If they had like a bone cancer, for instance, those types of pains. That, again, there's a lot of anecdotal stories about that these patients can actually have a reduction in their pain. But I think that there's also one further, even further than that. Although these are mostly in animal and in petri dish studies, if you go to the NIH webpage, cancer.gov, and you put in, or even if you just Google cancer.gov and cannabinoids, you will find several studies listed right on the government's webpage that talks about how the cannabinoids, both THC as well as CBD, have been shown to suppress tumor growth. So that to me brings a whole nother area of consideration here. Might the use of cannabinoids be able to prevent a person from having cancer relapse? Now, I'm not saying that that it will, not saying that it won't, but one of the questions that we must ask ourselves every time that we do a treatment, again, is both informed consent and what's the potential benefit versus what's the potential risk. Now, when we're talking about cancer, the benefit of stopping cancer from coming back is probably would overcome almost any risk. Heck, we're willing to put chemotherapy into somebody in order to stop it from happening. And one could certainly argue that the side effects of chemotherapy are worse than the side effects of cannabis, even in the worst case of cannabis overdose, probably. So if a patient says to me, hey, I don't want to have cancer come back, I have a history of cancer, here's my pathology report, so I therefore qualify, I would be very willing to put that patient on cannabinoids just for the possibility that it may decrease their cancer from coming back. I'll give you a case in point.
Okay.
Friend of mine who has a form of pancreatic cancer called a neuroendocrine tumor. It's not the carcinoma form, the adenocarcinoma, that pretty much is unfortunately life-threatening to everybody. But he was a stage 4 when he was diagnosed, so he was pretty far along. And so he was entered into a study at Moffitt. 25 people were entered into the study. He's the only person who, when he was diagnosed, started using cannabis on a regular basis. The other 24 people are dead. Now, his cancer therapy specialist is saying that the only explanation that he has, besides God's good graces, is his medical cannabis. And this particular individual, because now he is actually, getting enrolled so that he can be getting it legally, but he reports that, because when he was not getting it legally, that supply was an issue for him. And when he would run out within 3 to 4 days, he would actually feel his tumor start to grow, and they would actually be able to diagnose that. I mean, and to palpate it, see it on ultrasound. And then when he would get back onto the cannabis, it would start to shrink back down after a few days. And they've been able to show that 10 years later, it has not progressed at all, compared to where it was before. So, of course, that's an anecdotal story, but it's a very strong story for it. So, obviously, there's some people who are going to want to use who are getting cannabis recreationally off the street, who are going to want to do this so that they are legit. But at the same time, this is a real deal thing. So, I have some anecdotal evidence that this will work to suppress cancer growth. And again, risk versus benefit. Do I think that the benefit of cannabis outweighs the risk of cancer coming back? Yeah, I feel strongly about that.
You are aware of this marijuana solution.